Good morning, everyone. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health advocacy, awareness, and behavior change. And I welcome you all to the second edition of Ayushman Bharat Conclave, a unique gathering of who's who of public health. Ayushman Bhava, this ancient adage, used to evoke blessings of long and healthy life, aptly highlighted how our ancestors clearly knew what matters most for fulfilling and productive existence on this planet. And being Shatayu or a life spanning 100 years seemed to have been a common phenomenon in that era. However, our modern society apparently lost that sense of priority for health as at the turn of 20th century, India's average life expectancy was as low as 22 years, which only slightly improved to 34 years at the time it became a modern sovereign republic. Over 7 decades later, though we have doubled our average life expectancy, for majority of Indians, living a long, healthy, and productive life is still a distant dream, as the cost of getting that life can take away the very meaning of it. The price that they have to pay for restoring health or just part of it pushes nearly 5.5 crore people, which is more than the population of South Korea, Spain, or Kenya, into poverty within a year. And amid this scenario, September 2018 witnessed a most decisive step towards making good health and care available to those who could not afford it till then or would have gone bankrupt in an attempt to get it. This beginning, known as Ayushman Bharat, heralded by the Prime Minister Narendra Modi in form of Pradhan Mantri Jan Arogya Yojana (PMJ), the ambitious and world's largest public funded health insurance scheme, coupled with the mission of transforming our primary health setups into holistic health and wellness centers, has completed over 2 years with an outcome that certainly boasts of an impressive start and promises far reaching consequences in making Indians again live long and healthy life. Not only that, this has also played a critical role in mitigating the impact of the ongoing pandemic on the vulnerable families, putting many doubts and cynicism around it to the rest. Today, when over 60 lakh Indians die of non communicable diseases like heart failure, cancer, stroke, diabetes every year, and over 90 lakh of us have been infected by coronavirus, Ayushman Bharat scheme has ensured that the poorest of us were not left in the cold. Nearly 1.5 crores of beneficiaries received cashless treatment in private hospitals for many such diseases, including COVID 19, for which many could have not reached or afforded any medical support in the past. While all this have revived the dream of ensuring equitable healthcare for everyone, everywhere, turning this into a reality will be an arduous trek to reach this distant goal. And as India is gearing up for digitization of its healthcare system under its another ambitious program, the National Digital Health Mission, which will further strengthen Ayushman Bharat as cornerstone of providing quality and affordable health services to crores of Indians, we at ISW Council are back with our critical forum, the Ayushman Bharat Conclave, in its second e-avatar. The conclave today will be focusing on understanding the building blocks for the road ahead and the need to holistically address all that threatens our health, including the ever growing burden of non communicable diseases as well as the newly revived threats of infectious outbreaks. And as it is happening on the eve of International Day of Universal Health Coverage, that is observed on December 12, we will again rededicate ourselves towards reaching the ultimate objective of ensuring universal quality health coverage for everyone, everywhere. So before we go ahead and introduce our very special and esteemed guests for this inaugural session of Ayushman Bharat Conclave 2.0, let's have a look on the first edition of Conclave that was held to underline the importance of this beginning and the possibilities it brought.
India, the fastest growing nation on the earth, faces the fastest growing health challenges with over 1.3 billion lives at stake. In the wake of a swelling disease burden and severely compromised health ecosystem, it was imperative that everyone gets talking about good health. Aiming to create continuous advocacy for health, the right to good air, good food, good water, and good healthcare, as well as many other aspects of holistic health. Policymakers, various industry captains, community leaders, innovators, health experts, celebrities, and influencers deliberate upon the many challenges and opportunities of improving health outcomes in India. The Integrated Health and Well-being Council initiatives have become the platform of choice to launch various impactful programs that drive the country towards better health. Heeding to the growing sentiments of making healthcare more accessible, the Government of India, under the leadership of Prime Minister Narendra Modi, launched the Pradhan Mantri Jan Arogya Yojana, popularly known as the Ayushman Bharat, in September 2018. With the launch of the mega health scheme, health has become central to major public discourses. With the vision to amplify these efforts, we bring to you Ayushman Bharat Conclave, a multilateral forum that would engage various stakeholders, build larger consensus, and drive sustained advocacy to achieve universal health cover for all Indians.
Thank you so much. So now, without further delay, let me introduce our a very esteemed panelist for this inaugural session. We will be soon joined by Honorable MOS for Social Justice, Shri Ramdas Athawale. But before that, let me introduce Dr. Ambrish Mithal, who is the member of Governing Board of NHA. NHA, the National Health Authority, is the agency which is implementing this ambitious PMJ scheme in our country. He's also the chairman and head of endocrinology and diabetes at Max Healthcare. Among the finest healthcare practitioners of India, Dr. Mithal was honored by the Government of India in 2015 with Padma Bhushan, the third highest Indian civilian award, and for his outstanding contribution to the field of medicine. And more recently, Dr. Mithal has been nominated the governing council of NHA, and he's also the president for AIIMS Gorakhpur. We are also privileged to have Dr. Professor Y.K. Gupta with us. He's the president of All India Institute of Medical Sciences, AIIMS Bhopal. Dr. Y.K. Gupta is the president for AIIMS Jammu as well. He is the principal advisor for Department of Biotechnology, Government of India, and the former Dean of Academics and Head of Department of Pharmacology at All India Institute of Medical Sciences, New Delhi. Professor Gupta is also the chairman and member of Institutional Ethics Committee of reputed institutions like IIT Delhi, ILBS Delhi, and Medanta, as well as AIIMS Delhi. Thank you so much, Dr. Y.K. Gupta, for joining us today. We are joined by Dr. Nishant Jain. He's the program director of German International Corporation, GIZ. Dr. Jain is a thought leader in the field of health systems, health finance, and health insurance from past 16 years and has demonstrated expertise across countries for the areas of program management, health system reforms, quality and public-private global partnership, and monitoring and evaluation. He's currently heading the bilateral cooperation program for strengthening health systems, health financing, and health insurance through support to the government of India and various state governments. And he's also advising government of India on design and implementation of Ayushman Bharat PMJ scheme, and was also part of the team or leading the team that helped the government in putting together the Rashtriya Swasthya Bima Yojana RSBY in India that covered 140 million population and has been appreciated world over, and actually was the scheme which was there before PMJ. We are also joined by Dr. Sudhakar Sinde, CEO of State Health Assurance Society from Maharashtra, and Dr. Hema Diwakar, CEO of Artist Asian Research and Training Institute for Skill Transfer. Dr. Hema Diwakar is one of the very vocal and frontline champion of women health in our country. She has been the president of FOXY, the apex body of over 38,000 gynecologists of our country. And she is also the FOXY ambassador for FIGO, the International Organization of Gyne. She is also the member of ISW Council Apex Board. So thank you all, our esteemed panelists of this morning, and also the panelists who have joined from the next sessions, Mr. Ravi Bhatnagar, as well as Dr. Priya Balu. Thank you so much for joining, all of you. So let me begin. By the time I think Dr. Nishant is going to join. So is Dr. Nishant with us? I think he's still not. Okay, so let me start with Dr. Y.K. Gupta. Dr. Y.K. Gupta, you are the veteran of India's public health system. You are heading to AIIMS. And, we know that for people who cannot afford the private, which is the kind of hallmark of quality healthcare or the global standard healthcare in our country, have to go to the government hospitals and have to depend on the government support for seeking health. Ayushman Bharat scheme, which came in 2018, has kind of revived that long-standing dream of getting universal health coverage, and that to quality healthcare because of its public, private partnership model. And we or a person who is beneficiary of that scheme can even walk into a private hospital and get a healthcare which can cost up to 5 lakh, which is a big number for India. How do you see this scheme, and what has been your kind of experience in this last 2 years, that how it is becoming a game changer in terms of making people afford quality health, but at the same time not go bankrupt because of it?
I would give one example of my driver whose son suffered from, he wanted to have a transplant of a valve, and he would have definitely not survived otherwise. And he was in front of my eyes, he was the witness of this transformation. He went to a private hospital, I will not name because initially there was some reluctancy, but he got admitted and got treated and got best of the treatment what he deserved, and is now one of the happiest person. He is not only fan of me because I advised him, he is now bhakt of our Prime Minister who introduced this. I must say that there may be thousands of such people who got suddenly transformed, whose child, mother, parents, brother, or himself got advantage because of this change. I would say that initially there was a reluctancy by the hospital to adopt this because there was some logistic, some apprehension. Still people believe in some state governments, still people believe that this is may not be effective. But people are realizing that through this you and every citizen had the right to get the best of the treatment. And that is the basic fundamental right of the person. And in this direction, we are also working. In fact, I am chairman of National List of Essential Medicine. We have to have the medicine which are affordable, which are quality, and which is available at all the places. And that's why the government of India is making all efforts to make the drugs available, affordable, and also devices. That is also under my chairmanship. We are looking at the devices, maybe the implant, maybe the knee joint replacement, or maybe the cataract implant, or maybe you do any dental implant, and then you maybe the devices and the public hygiene, maybe the sanitary napkins. These are the things which each and every individual in the country should have in adequate amount at affordable price at all the places. The innovation must survive. The incremental innovation is must happen, but basic necessity is the fundamental right of every citizen. Over.
Thank you so much, Dr. Gupta, for highlighting such a, I think, uh, live case study of your driver, where he could afford a quality health care because of this scheme, which converted him into a bhakt of our Prime Minister as well. But I think that much bhakti is enough, good, because if you are getting that kind of support because of a step, it's wonderful to understand. But the point you have highlighted very well is that apart from this, I think there is a need of a lot many things which are, from hygiene to preventive care to many other things. So let me so I'll come back to you if we get a time, but you people can take a little bit more time to explain, because it is going to be more of a address format of this session. So let me go to Dr. Ambrish Mithal on this. Dr. Ambrish Mithal, you are taking care of a disease where the prevention is something very, very important. Prevention, and many other cure which are which has to be there at the primary level, also to diagnose on time, to prevent on time. How do you see that while this Ayushman Bharat, of which you are in the counseling, council of advisory council, how it is bringing that secondary, tertiary care, but are we, somehow missing on the preventive side of it? That the another important wheel of this Ayushman Bharat, vision, which is health and wellness centers. How do you see the overall this scheme unfolding at the both level?
So I'll make a few points. I think thank you very much for inviting me here. First of all, I'm delighted to be in such distinguished company of very well-known people. And actually, we look at it from both ends. You see, when you see healthcare, it's like a stream. It's like a stream that starts, at the beginning, upstream care, and you keep going down, it is downstream care. So you can approach the problem from both ends. You can approach it from the upstream measures or downstream measures. So when we talk of Ayushman Bharat, which is a unique pioneering sort of project of the government, which has attained remarkable success in the short time span as it's been brought out, and we are primarily looking at treating disease. The focus of Ayushman Bharat, the primary focus, the first focus, and then there are other things as you were talking about. But the primary focus is to provide treatment to people who would not have had access to that treatment earlier. And that is the primary goal, and in which it is succeeding. There is a lot of scope to go, but there is undoubtedly initial success, and it needs to be built more and more with more defense safety mechanisms, with more monitoring, with more expansion, so that kind of thing. So undoubtedly that is the key difference between Ayushman Bharat and other previous schemes was the involvement of the private sector. I think the truth of the matter is, whether we like it or we don't like it, having worked extensively both in teaching, full-time teaching institutions and in the private sector, I can say that undoubtedly over the years a gap has happened in terms of quality of care. Now, sometimes when we think of public sector, we think of AIIMS Delhi. But that is not a good example. I mean, that is our apex institution. We are all products of that place, and that's not a good yardstick to judge the public sector care by, because that's one institution. Okay, we have to look at public sector care that is reaching the remote parts of India. And I think there, definitely the public sector care, quality of care has to be pushed up. So any government which is now trying so hard to provide quality care to its citizens has to make sure the public infrastructure is built up so that this gap is narrowed. And we can have a very clear distinction. We can have a clear distinction of having really good primary and secondary care in the public sector, and then work towards tertiary. We have to keep tertiary care open, of course, and all these new AIIMS and all will add to that. But the fact is that our secondary, primary and secondary care has to be the responsibility of the public sector in some way. So unless we strengthen that, we'll always be juggling between private, public, and there will be adversarial rather than cooperative, sort of things. If we can say that a gallbladder surgery can be done in any government hospital at a reasonable cost and at with high quality, acceptable quality, fantastic. A lot of your things are covered. What I'm saying is that this secondary and tertiary thing has to be clear, that we should not lose sight of the fact that government health structures should be working also towards strengthening, which they are, of course, but should be focusing more on strengthening our primary and secondary structures. In the tertiary, in the Ayushman Bharat thing, yes, there has been a whole lot of increase, but we have to understand that the costs of tertiary care are very high. And to make it sustainable is going to be a challenge. There's no doubt about that. There have to be ways, both ways. We have to reduce the cost of tertiary care by indigenous implants and devices, etc. And as Professor Gupta was saying, if you're doing a knee implant, and if every hospital is buying a few knee implants, and their negotiation capacity is very limited, but if one is selling to the government, as they do in Germany or NHS in England, then you can get the prices down very substantially. So prices of devices and consumables have to come down, and that's where government is trying a lot. I know NHA is also trying a lot to bring those down. That will reduce the cost of tertiary care. We just see those big costs. We don't realize the whole chain that happens in between. So cost of reduction of tertiary care is one of the very laudable goals. Otherwise, this gap will continue, and it'll be very, very hard for our country, which is trying so hard at this stage and facing the pandemic and everything, to be able to deal with tertiary care and subsidize all tertiary care, or reimburse all tertiary care is going to be a big challenge. Okay, so that is one thing that I thought is important. And coming back to your point about primary care, and I think that's important. Primary healthcare delivery in India has improved, but not much from the time I was an intern, and Professor Gupta is there, Hema is there, they can all vouch. It really hasn't changed that much if you go to grassroots. And that is unfortunate. So when you see these horrible stories on television and then you say, this is what I've seen all the time, it doesn't come as a surprise to you. So primary healthcare is one of the pillars of the Ayushman Bharat, but it's not one of the things that has got focused so far, although it is listed there. I firmly believe that primary healthcare is very, very important in determining our success, because ultimately, if we want to reduce the burden of cost for tertiary healthcare, unless our primary healthcare is good, we will never succeed. And moving a little more proximal, little more towards the root, then you say wellness. Primary healthcare is still some disease, but you talk of wellness. So wellness is health and wellness, and we know that very well. And I think it is without that, unless we do all this simultaneously, we'll be expending a lot of money on the tertiary care with all our effort, and it will not be, at some point, it will catch up with us. So our focus has to be on our primary health centers, our primary health care, and moving even further up at the root of the problem. Where does it start? I was saying we are going from downstream to upstream. We are going from the part where the river meets the ocean, that is the tertiary care. And we are actually going up to secondary and then primary and then to the source. The source is healthy air, clean water, and healthy food. Now, if any country like ours, which is one of the fastest rising countries in the world, if we have to make an impact globally and help our people, we have to make sure that there is no malnutrition. We have to make sure there is clean drinking water, and we have to ensure that we just don't see this worsening of air quality that is happening all the time. The lockdown told us how much of it is man-made. The moment there was a lockdown, I saw such skies that I had never seen before. So, or saw as a child. So what I'm saying is that it is important that and the last part, that is the health, the air, water, food, that requires more than the health ministry. It requires a lot of other people to collaborate and everyone to collaborate. So let me take the example of nutrition again. Okay, nutrition is we still have above 35% undernutrition in children. 35%. 1/3 of our children are still not getting enough nutrition. On the one hand, our life expectancy has gone much, much better. So something we are doing right. On the one hand, our modern medicine technology competes with anyone in the world, right? We have the best surgeons, the best physicians, the most skilled high-end stuff. On the other hand, 35% of our population is still malnourished. Well, they will get good care in Ayushman Bharat, but we have to also make sure that they're not undernourished, right? So the potential of the population cannot be realized optimally till these things are addressed. So this is macronutrition. Macronutrition meaning protein deficiency, calorie deficiency still exists in so many parts of India. And really, that is, I know it's a focus already, but we need to push more and more, whether it requires more finance, whether it requires more inputs, more human resource, whatever it is. It's not an easy challenge. Yeah? It's not something that can be done overnight, but it requires a lot of inputs in that regard. So I think we need to look at it from that point of view, that if we are trying to improve the health of the country, these things have to be taken into account. I'll give you an example of one of the sort of more successful drives here. That if we talked of macronutrients and protein malnutrition and deficiency in children, what about micronutrients? Vitamin A, iron, vitamin D, which is one of my major passions, so many things. There is an excellent fortification program that has been initiated by the government. As late as 2016, the standards were set, and gradually it's changing. And even the other day, I was in a conclave of the Food and Safety Standard Organization of Association of India, and we actually, I was really delighted to see that more than 40%, I think 47%, forgive me, it's 45, 47% of the branded milk that is sold in India now is fortified. So, and this is in less than 2 years. So I'm sure in a couple of years, at least all the milk will have enough vitamin A and D to take care of so many of these things. Similarly, in midday meal programs, rice is being fortified. So it is just spreading like this. So I think I see in 3 years that a lot of the micronutrient deficiencies will be attenuated to some extent, at least, if not taken care of. So, we have to, as I said, act on multiple levels. Only then we can really get into this whole thing. And again, coming back to Ayushman Bharat per se, I would say that the private-public partnership model is amazing. We have to engage more and more. Now, sometimes when we sit on one side, we think of the other side as completely, talking something that is irrelevant both ways, because I have sat on both sides. And actually, the truth is, as usual, somewhere in between. The goal of the healthcare system, private or public, is to take care of patients. That is our goal. There's no confusion about that. So I think that's how I would look at the whole thing.
Thank you so much, Dr. Mithal. And I may like to come back to you, on the public-private partnership. You are somebody who is also, practicing at the private level, and those concerns which come up in hospitals or among even the doctors sometime because of certain aspects of the design of Ayushman Bharat. We may, if we get time, we will talk on it. But let me go to Dr. Y.K. Gupta again, since his remark was very brief, and then I'll go to Dr. Nishant Jain. Dr. Gupta, you are there?
Yes.
Yeah. So Dr. Gupta, Dr. Mithal has very, aptly highlighted about that this whole primary health space has not moved much, while we are seeing a wonderful, focus, mission mode, work on the area of secondary and tertiary care. I think that gives a better showcaseable result also. Somebody gets a heart attack and gets treated without spending money, gives a wonderful case study. But what about somebody who is, kind of chronically malnourished and getting into or adding to the health, the disease burden, and we are not able to keep our healthy people healthy at multiple level, which Dr. Mithal also said. So what is your opinion, being a veteran in the public health and also especially the public funded health as well. You are taking care of two AIIMS, where all the patients try to converge in every AIIMS. Delhi has been that uh, uh, kind of converging point. I'm sure all these AIIMS will also become the center of excellence at their own level and will start delivering the similar quality of health. But what about the primary health? What is your opinion on that, and how we make that as the focus of Ayushman Bharat?
I fully agree with what Ambrish has said. And if you just see, when I was active in AIIMS Delhi as a dean and as a professor and also member of several committees, what we observed was majority of the public in Delhi or even outside Delhi, different AIIMS, many people come of minor ailments, which could have been managed, which could have been treated at the primary center or the secondary center. And this basically makes a crowd at AIIMS or which are meant for traditionally a referral hospital, and that takes a significant amount of the load of the clinician and depriving the care which the tertiary care hospital is meant to give for the specialized or the complicated cases. So now, if you just see the analysis, perhaps the primary health care setup is not equipped or not functioning as it should have been. The entire primary healthcare setup or the Indian healthcare system now is gearing to upgrade that and upgrade. And that's why you see there are so many medical AIIMS are coming, 26 AIIMS are coming that will offload. That will have the percolating effect on the district hospital. That will have the percolating effect on the primary health center. Still, the facilities to the medical profession, to the paramedical profession, which they should get in the primary health center, is now differential. That should improve. That will improve their state. That will improve their affinity to that population, and that will improve the dedication. Just say that you go there and have a dedication. I think that will work better if they are provided good facilities. The infrastructure in terms of a medicine availability at the primary health center, and that's why we have created a essential list of medicine which classifies as the P, S, and T. P means those drugs which must be available at the affordable cost and quality at the primary health centers. The S means those medicines which should be available at the secondary health care center, and those medicines which must be available at the tertiary health care center. And therefore, these are and we are also dividing this in terms of devices, in terms of public hygiene products, that these are the basic fundamental devices which must be available at the primary health center, secondary, and this list will be out, and then the government will make sure that these devices are available at the primary health center. The important issue sometimes also comes about the quality of the medicine which is available at that place, the public awareness of the medicine. And I must say that today, Corona is in pandemic. Tomorrow, there is another pandemic in the box, which is antimicrobial resistance, AMR pandemic. So many people are taking antibiotic, go into villages, no prescription, every antibiotic is available at the chemist shop. So primary health center, secondary health center, even in the tertiary healthcare center, the rampant use of drugs, particularly antimicrobial agents, is a disaster. And that happens because the education awareness in the people about the use and misuse of the drug, awareness in the chemist about the law and the law enforcing agency, and also in the tertiary care hospital where there is people want to give a shot of the drug and then they think that this will be the best for the patient, but this will ultimately be the disaster for the society. Another important thing I would say that we should, how much time we create in our video, TV, and if I see the slot of the advertisement, negligible for creating awareness about health and health related issues in primary health center. I think that should also be faster. And I fully agree with that. Pradhan Mantri Yojana and of cleanliness, all those things made a difference. But still long way to go. If you have a preventive measure on just telling them that these are the diseases which can be prevented by simple hygiene, which can be done by everybody, can contribute into that. If there is a punishment, severe, strong punishment, those who violate these simple hygiene discipline. I think why people, Sweden and Denmark and the people are so hygienic, because if they do not follow, they are punished. And if we just say that you do it, request them, it doesn't work. There has to be punishment also.
But
And I
there
believe
has to be availability also before
there has
company.
to be availability, but the no civilian, no society person should be allowed to throw garbage on the road from the house, and nobody should be allowed to pollute the air. Nobody should be allowed to adulterate the food, because ultimately this may. So I think these are the fundamental things which society and the government and the NGOs should work together.
Yeah.
Then only we will achieve.
Thank you so much, Dr. Gupta. Important points. So while we were talking about the primary side, now we have with us the two people who are involved in this whole NHA and PMJ work. We have Dr. Nishant Jain with us from German Corporation. So, Dr. Nishant Jain, you have seen RSPY, you have been and you are advising on PMJ as well. Give us some, because the audience today would also like to understand what the PMJ has already achieved and how it is going to unfold further. And also in terms of how this whole National Digital Health Mission is also going to have a little more boost up for this entire mission of ensuring that at least people who require secondary and tertiary care are getting it when they need it.
Thanks, Kamal. Thanks, and thanks for inviting me. And nice to see all the distinguished panelists. Dr. Mithal, nice to see you again. So, as you rightly said, Kamal, that Ayushman Bharat is a big initiative by the government, very ambitious. And of course, it's only a little bit more than 2 years which have passed for the scheme. But in the small time, it has achieved quite a lot. It would have achieved much more because of, we all know the situation since past 6 to 8 months, what we are facing. So of course, everything got impacted, including the scheme implementation. However, I will still say that the trajectory of the scheme have been quite good. So when we started with roughly 28 odd states, and now barring 3 states, all the other states have agreed to join the scheme. 1 state has not yet started the implementation, but rest of the 32 states and union territories are already implementing the scheme. And as you also know that we in the past roughly 2 years, we have now more than 1.3 crore treatments which have taken place under the scheme across various states, and claims worth, I will say, more than 16,000 crore rupees have been raised under the scheme. So in terms of numbers, it's good. In terms of we have more than 24,000 hospitals empaneled under the scheme, which means roughly 12,000 are private hospitals out of that. So if somebody sees from a bit outside, just the big numbers, things looks quite good, and they are good. But of course, there is a need for a lot of improvement also. So for example, that even though we have reached more than 1 crore, but I think that keeping view the hospitalization rate in India, the need for the hospital treatment, it can be much more. And what we had seen that just before COVID, the way things were going, we would be doing almost more than 1 crore hospitalization every year. But of course, it came down drastically, and now it has again started picking up. So on an average, I think we have reached almost 70-80% of the pre-COVID numbers already. And I hope that in the next few months, things will be much better. And also with the announcement of vaccine and all coming, I think that things will be improving much more in terms of getting the numbers right. In terms of the engagement with private hospital, what Dr. Mithal was saying, for example, this public-private partnership becomes very important. But I think one of the challenges which still Ayushman Bharat faces is bringing much more private hospitals in its network. So the smaller and medium-sized hospitals are much more in the network rather than the very big ones. So some of them are there, but many of them are still not there. And that's where I think the challenge is, that how do we bring those hospitals, what are the bottlenecks or what are the inhibitions they have regarding the scheme? Is it regarding the rates which we are providing to the hospital for treatment? Is it regarding the claim payment, if there are any delays they foresee, or is there some previous experience which they had, which they didn't like, and that's why they are skeptical? So we, we have to think in all those lines, and then only we can actually see that how do we bring those hospitals in. So that is number one. Number two, that in a country like India, where especially for the poor and vulnerable, which are being targeted through PMJ, is another challenge, that how do we actually bring those kind of population, make aware about the scheme. So even if they are covered, because unlike RSPY, which was an enrollment based scheme where you need to have a smart card before you can go for the treatment, this is an entitlement based scheme, which means that if you are in the list, you are covered. But how do you know that whether you are in the list or not? Sitting in some village in some state, you may not be aware, and suddenly you are covered now under the scheme. And until unless somebody will come and tell you, it becomes very difficult. Even if somebody tells you, you may not feel very confident in entering a big hospital, because you think that maybe they will throw me out. I don't know whether they will ask money or not. So that is why it's very important that not only people become aware, but they are also told about their rights, that, you know, if there is any problem they face, where they can complain, if there is any issue, where they can go, all these things. And that is why it's very important that Ayushman Bharat took a decision that now we'll start issuing these e-cards proactively. So earlier, the idea was that only the cards will be given when a person reaches a hospital, because before that there was no need, but person was anyway covered. But now government started this proactive card issuance, where people will get the card in advance before they go to the hospital, so that they have a piece of paper in their hand and they feel more confident that, you see, I have this Ayushman Bharat e-card, so when I will enter an impaneled hospital, they will not drive me away or something like that. So that is very important. So that proactive enrollment and issuance of card has started. Of course, that does not mean that if you don't have card, you can't go. You can still go if you're eligible. But the issuance of card is very important, and some states have done remarkably well, and many other states are still catching up. But I think that in next 6 months to a year, a large percentage of Ayushman Bharat beneficiaries will get these e-cards, which will help a lot. So I think this is and then this awareness building comes into picture. And I think, like what government did, like with Jan Dhan, or with, you know, Swachh Bharat, these kind of big, I think, campaigns needs to be done. And I think organizations such as yours and many others can play a very important role, because it's not only government which needs to do, it has to become a movement. People will need to understand that they are covered. And one of the very gladdening thing I will say has happened under Ayushman Bharat PMJ, that many states have already expanded the scheme. So in theory, we cover roughly 50 crore people. But because of the expansion by states they have already done, we cover more than 65 crore. Already people are covered under the scheme. And that too, when 3 states, big states, West Bengal, Telangana, and Odisha, are not in the scheme. So if they will come, maybe we'll reach 70 crore or so. So that is a good thing, that so many people are already covered under the scheme. But at the same time, whether we have enough healthcare providers in the network to provide them the treatment, number one. And number two, that even the treatment which is being provided, is it of good quality or not? So some hospital may provide better quality, some hospital may not. And that's where the whole idea, where Ayushman Bharat is trying to work on, trying to have NABH accreditation for the impaneled hospital, trying to see some kind of grading system to work with NABH to come out with a grading system, so that hospital have some motivation to improve their quality. Also, what is being done to come out with standard treatment guidelines. That is something again on which people are working, so that for each treatment there is a pathway which is their guiding pathway, which can help again. So those kind of things we are working on, but of course it takes time. It's not an easy thing to do. And you also talked about NDHM, National Digital Health Mission. So this is, even though it's completely separate from Ayushman Bharat, but since NHA is working on both of them, there is a lot of overlap, because under Ayushman Bharat, every patient gets a patient ID. But under NDHM, unique health ID has to be given to every citizen of the country. So that can become the base. Similarly, every provider will get a unique provider ID, a hospital, a health provider ID under NDHM. Ayushman Bharat gives his own ID. Ministry of Health has something called NIN, they give their own ID. IRDA has something called Rohini, they give their own ID. So instead of all these various health hospital ID, there'll be one ID given by NDHM. That will be very good. And also creation of electronic health records, which will come. So I think NDHM is a very good step towards that. But as we have seen in case of Aadhaar, it's easier said than done, because Aadhaar was just issuing one number to every citizen of the country. And that itself took so much time and effort, and still we have not reached 100%. So assuming that this national health ID will start going to the people very easily, and in the next 1 year we'll be able to achieve, is not an easy thing to do. So that's where we have to be quite innovative in that, and try to link with various schemes, like PMJ can be a good platform to do that. Similarly, other schemes like ESI or CGHS or other government program, all of them have to be linked. Then this NDHM can actually make much faster progress in terms of achieving its objective. So I'll stop here, Kamal, and then maybe we can talk later. Thank you.
Thank you so much, Dr. Jain, for giving, I think quite assuring information about how PMJ is contributing substantially, and definitely, as you and that's good to hear that you yourself is saying that there's a long way to go to actually achieve what we intend, or what we, the country need to achieve. So let me go to Dr. Hema Diwakar in between. Dr. Diwakar, so you heard, I understand that your passion area is that women's health, and that the women of our country, which is, let's say, 50% of our population, should get everything from primary health to wellness to good maternal care to for all the diseases which may follow as part of NCDs or any other infectious disease. How do you see, as a champion of women's health, how do you see Ayushman Bharat contributing this thought, this scheme, these big numbers, which 24,000 hospitals impaneled on Ayushman Bharat, 1.3 crore I think hospitalization has already happened, and almost 16,000 crore rupees worth treatment has been provided. How do you see, as a healthcare provider, as a women's health champion, how it is helping that, and what do you expect further from it?
Namaskar. Thank you, Kamal, for this kind invitation and the opportunity to place some of my thoughts and action points in front of this esteemed panel and the audience as well. As you rightly remarked right at the beginning, Ayushman Bharat resonates so well with our ancient philosophy of Ayushman Bhava. Okay, so in keeping with the same tone and tenor, I would say that another cliched ancient saying is Sarve Janaha Sukhino Bhavantu, which also goes towards universal healthcare. Okay, that's what it really means, because Sukha is like health, and health is wealth is always what we've been seeing and saying. And the taglines that we have often used: prevent illness and promote wellness. Okay, and passion for quality healthcare. So moving with these, in alignment with what our government in general is trying to do, I would really like to say that yes, the vision of accessibility and affordability is in the right direction, but the supply side, that is the very first reason I wanted to connect and collaborate with IHW Council, if you remember, is Integrated Health and Wellbeing Council. That name caught my attention, and out of the blue, I just got in touch with you because I said, Kamal, we have to make the 150,000 health and wellness centers actually functional. From some innovative ideas, let's move towards implementing that. And that is the track I have been again and again urging you to help us, collaborate and follow the track. Having said that, again, the National Digital Health Mission, it's a wonderful opportunity for us as healthcare providers to task shift, to build the capacity of the frontline healthcare providers, which will truly make this Ayushman Bharat Wellness Centers really move forward.
So we are now joined by Honorable Minister MOS, Minister Social Justice and Empowerment, Shri Ramdas Athawale. And thankfully he joined us again on this second edition. He was our chief guest when we initiated this conclave in the last year, along with Dr. Indu Bhushan, the CEO of NHA. So may I request the team at Honorable Minister's office to switch on the camera. Sir, Honorable Mantri ji, good morning.
Namaste ji.
सर आई नो अभी आप जस्ट एयरपोर्ट से घर पहुंचे हैं और आई एम सो सॉरी फॉर काइंड ऑफ प्रेसिंग इनटू योर टाइट शेड्यूल दैट टू अटेंड आवर दिस कॉन्क्लेव टुडे, but as I know that you stand for all that is needed to be ensured for our downtrodden, our people who cannot afford health, who cannot afford wellness or any other part of, and you firmly believe that health is the part of social justice. If we can't make our people at all strata healthy, we can't provide them that social justice which our constitution actually promises to provide each and every individual of our country. So thank you so much for joining. I will definitely wait till the time you finish your tea, and I'm really sorry for kind of making you juggle with multiple things in this morning. So I request to kind of grace this occasion with your kind words, and also the audience who is watching, your vision that how the government of India is helping the poor of our country with this Ayushman Bharat scheme.
तो आज जब आयुष्मान भारत ई कॉन्क्लेव के दूसरे संस्करण में आज आप सभी के बीच या आने से मुझे बहुत बड़ी खुशी हो रही है। मैं इंटीग्रेटेड हेल्थ एंड वेल बीइंग काउंसिल और मुख्य कार्यकारी अधिकारी श्री कमल नारायण को इस ऐतिहासिक योजना पर चर्चा जारी रखने के लिए धन्यवाद देता हूं, जो सबसे गरीब भारतीयों के लिए फायदेमंद साबित हुई है। 2018 में लॉन्च होने के साथ आयुष्मान भारत के 50 करोड़ से अधिक लाभार्थियों को सस्ती और सुलभ स्वास्थ्य देखभाल का वादा किया था। भले गरीब लोग भारी भरकम बिलों के डर से निजी अस्पताल जाने से डरते थे, आयुष्मान भारत ने यह सुनिश्चित किया है कि लोग अपनी पसंद की सुविधा पर स्वास्थ्य सेवाएं प्राप्त कर सके। यह जमीनी विकास है। नियमित स्वास्थ्य जरूरतों के साथ गरीबों की सेवा के अलावा आयुष्मान भारत ने कोविड-19 महामारी के बाद से एक महत्वपूर्ण भूमिका निभाई है। उन्हें सस्ती स्वास्थ्य देखभाल तक पहुंचने में सक्षम बनाकर जहां भी वे कृपया आयुष्मान भारत ने सामाजिक न्याय के एक उपकरण के रूप में खुद को मजबूती से साबित किया है। मैं एक और साल के लिए ISW काउंसिलिंग के आयुष्मान भारत कॉन्क्लेव में वापस आने से बहुत खुश हूँ। मैं पिछले साल भी इसके उद्घाटन संस्करण में मौजूद था। आयुष्मान भारत की सफलता से पता चलता है कि सामाजिक न्याय हमारे लिए प्राथमिकता है। हम यह सुनिश्चित करने के लिए कड़ी मेहनत कर रहे हैं कि प्रत्येक भारतीय को उत्पादक जीवन की आवश्यकता हो। यहाँ तक कि एक भारत स्वस्थ भारत की दृष्टि को साकार करने के लिए महामारी को चुनौतीपूर्ण समय में भी मुझे बताया गया है कि आज कई विषयों पर चर्चा की जाएगी। मैं राष्ट्रीय स्वास्थ्य प्राधिकरण के शासी बोर्ड के सदस्य डॉक्टर अम्बरीश मिथल, अखिल भारतीय आयुर्विज्ञान संस्थान AIIMS भोपाल के अध्यक्ष डॉक्टर प्रोफेसर YK गुप्ता जी, जर्मन इंटरनेशनल कॉरपोरेशन के कार्यक्रम निदेशक डॉक्टर निशांत जैन और एशियन रिसर्च एंड ट्रेनिंग इंस्टीट्यूट फॉर स्किल ट्रांसफर की CEO डॉक्टर हेमा दिवाकर को समय निकालने के लिए धन्यवाद देता हूं और विचार विमर्श के लिए यहाँ मैं मौजूद हूं। मैं श्री कमल नारायण जी को भी धन्यवाद देता हूं। उन्होंने अपना समर्थन जारी रखा और कॉन्क्लेव के लिए शुभकामनाएं मतलब देने के लिए आज मैं यहाँ मौजूद हूँ। आप लोग जानते हैं कि आयुष्मान भारत योजना माननीय नरेंद्र मोदी जी ने गरीबों के लिए, मिडिल क्लास के लिए, या मतलब जो लोग इसके कैटेगरी में बैठते हैं, ऐसे लोगों को एक साल में एक फैमिली को 5 लाख रुपीस देने का ये मतलब प्रोग्राम है और इससे बहुत सारे लोगों की जान बच सकती है। बहुत सारे हजारों लोग मतलब बिना पैसे से अस्पताल में भर्ती नहीं हो पाते थे, लेकिन अभी उनके पास 5 लाख की गारंटी है और कोई भी अस्पताल में उनको भर्ती करना ही चाहिए। और बाद में अगर जो बिल होता है 5 लाख में, जो लाख, 2 लाख, 3 लाख जितना भी बिल होता है, वो बिल डॉक्टर को आयुष्मान भारत योजना से मिलता है। इसलिए आई एम वेरी प्राउड because Kamal Narayan is also a very active personality and always he is also helping to all. And my ministry is social justice and empowerment. My ministry is also not health ministry, but my ministry is also giving the social justice to the poor peoples, the scheduled caste peoples, the DNT peoples, old age peoples, disabled peoples. And my ministry is also very active, working for all. Near about above 80% population is controlled by my ministry. And therefore my ministry's budget is this year's 2021 budget is near about 85,000 crore rupees. And disabled department's budget is 9,500 rupees. And therefore my ministry is also helping to all poor people, orphan peoples. And our ministry is also supporting Mr. Kamal Narayan. Kamal Narayan is also my good friend, and always he is also coming to my office, discussing many problems. But health problems is also a very important problem. You know that in this COVID-19 is very dangerous, and COVID came from China to all over the world. And on 20th February 2020 in Mumbai, in near Gateway of India, near Taj Mahal Hotel, there was one starch march with the ambassador of China, and I was present there. At that time, I have given the slogan, "Go Corona, go Corona, Corona, go Corona, go." That slogan was very popular. That slogan was went in all over the world, all over India. But when I have given the slogan, "Go Corona," but on 27th November, the Corona came to me, and I was admitted in the Bombay hospital near about 11 days. And then I came from the hospital after 11 days. But now I am okay. And every day I am giving the slogan in the Bombay hospital, "Go Corona, go Corona," and Corona go. Corona went from me. And therefore in these very difficult days, we are also fighting against Corona. The vaccine is also coming now. And India will be a very strong country to provide the vaccine, because there are 3 institutions in Pune, Hyderabad, and Ahmedabad. There are 3 institutions that are also producing the vaccine, and our Prime Minister is also very serious on this issue. And if the vaccine will come, then the death percentage will be come down, and Corona's percent should become down. Now Corona is also coming down and down, but the Corona is also there, and therefore I'm not going to take your more time, because today there is the function that the new parliament building near, you know that, where Mahatma Gandhi statue is there, and the behind Mahatma Gandhi statue there is a reception hall. Another some activities are there, but the new parliament building will be there, and therefore today our Prime Minister is also going to Bhumi Pujan of this new parliament building, and therefore now I came from Mumbai first time after 1.5 months, and I am going to attend that function, and therefore I am not going to take more time. But this seminar is also very important seminar. Kamal Narayan is very nice personality, very active personality. Always is also inviting you, and that very important discussions are there every time. And health is very important because health, there is no good health, and therefore health should be there. If we are powerful, then nobody should touch us, and therefore as our body, our health, as India's health is also very strong. Therefore, China is not going to touch India because India is also very strong now, and therefore our body should be strong. And but now I lost my weight in this Corona time, the lockdown time, near about 18, 19 kg, because I was going to exercise, and therefore now I am attending this your webinar, and therefore thank you very much. All the activists are also present here. Mr. A.J. Reddy, Himani Singh,
Dr. Sudhakar Sindhe is also with us, who is
Dr. Sudhakar Sindhe is from Maharashtra. He is from Mumbai.
CEO of Maharashtra State Health Assurance Agency.
Chandrakant Laharia, Ravi.
Ravi Bhatnagar ji is very important personality in the area of hygiene and wash. He is the head of Dettol, the company which make Dettol, and he is very active in providing hygiene and preventive, things for the society, and especially the children across the country. So very active person in the area and very big contributor of the health of our country.
Yeah. And another Ambrish.
Dr. Ambrish Mithal, he is the member of Governing Council of NHA, the agency जो आयुष्मान भारत को इम्प्लीमेंट कर रही है सर, उस एजेंसी को गवर्निंग बॉडी में डॉक्टर अम्बरीश मित्तल हैं. वो प्रेसिडेंट भी हैं गोरखपुर एम्स के, और भारत के सब बहुत बड़े एंडोक्रोनोलॉजिस्ट और डायबिटोलॉजिस्ट हैं. मेरी पत्नी भी इनकी पेशेंट रह चुकी हैं, और मोस्ट ऑफ द पीपल जो है जिनको डायबिटीज होता है वो दे एस्पायर टू गेट द सपोर्ट एंड कंसल्टेशन ऑफ डॉक्टर अम्बरीश मित्तल. डॉक्टर वाई.के. गुप्ता हैं, ही इज द president of AIIMS Bhopal and also AIIMS Jammu, which is in Samba district or sector. I hear Samba sector always in terror and the other military related stories. We have Dr. Suchin Bajaj also. Cygnus Ujala hospital chain है, गरीबों के लिए hospital chain है, उसके founder हैं डॉक्टर सुचिन बजाज, और बहुत सारा काम करते हैं. जिन लोगों को वो हेल्थ केयर नहीं मिलती, या आयुष्मान भारत आने के पहले भी उन गरीब लोगों के लिए इन्होंने हॉस्पिटल्स बनाए. और डॉक्टर हेमा दिवाकर, सो थैंक यू सो मच ऑनरेबल मंत्री जी. और आप नेचुरल फाइटर हैं. आपने कोरोना जब आया था तब कोरोना को जाने का जो है मैसेज दे दिया था, और कोरोना आपके पास भी आया और उससे भी आपने अपनी फाइट को कंटिन्यू रखा है. And I'm sure that you will have a wonderful health going forward.
Kamal Narayan ji, I am not only fighter, I am writer also.
Wonderful. So that we always get to hear, but today I did not get that one-liner or two-liner couplets from your side.
हाँ सर, आज कविता नहीं सुनाया आपने.
कुछ नई पार्लियामेंट के लिए, नए भारत की नई पार्लियामेंट पर आप सुना सकते हैं. वो that will be the right time.
तो मतलब जो प्रधानमंत्री जी ने शुरू की है योजना भारत आयुष्मान, प्रधानमंत्री जी ने योजना अनाउंस की है भारत आयुष्मान, इसलिए गरीबों के मन में आ गई है जान। हमें बढ़ानी है गरीबों की शान, हमें बढ़ानी है गरीबों की शान, इसलिए सब लोगों का है आयुष्मान भारत की तरफ ध्यान। तो ये मैं बताते हुए,
Wonderful, sir. Thank you so much for these
इधर
lines.
आपने
Capture the whole thought and vision and the emotions
हमारी
of
आपने
Ayushman.
इस समारोह का सफल कर दिया।
Thank you so much. So this was Honorable Minister Shri Ramdas Athawale. He is very kind person and has always been gracing and helping ISW Council in having our own or driving our efforts to achieve better health and well-being, or demand for it for the public. We don't provide health, but we just demand for it. So at least that is also important, and we make people aware that when and why they must seek health when they need it, and they must be provided health when they need it. So Dr. Hema Diwakar, please, you can continue your thought about how Ayushman Bharat also has to make our Ayushman women.
I think all the stalwarts here will agree that there are bound to be many interruptions in the form of challenges which we use for opportunities to connect and collaborate. So I'm happy to place the last bit of the thoughts when Kamalji said that she is very vocal. So I would say go vocal for local, because Nishantji just said that we must have set protocols. Being an ambassador to the international community, we have set up a scheme of things which says East meets West, because everything that happens in the West, contextually, the feasibility in our part of the world is not the same. So we have to devise what is feasible, what is pragmatic, what is practical, what is doable in our context. And therefore, through FOXY, through FIGO, for women's healthcare, we have aligned a set of very simple and very doable at every level of healthcare. So that in the previous discussion on cancer cervix as well, I had said to the Vipul Agarwal, I think from Ayushman Bharat, that if the primary care of screening and vaccination is given to the women, then you can treat double the number of women at half the cost, because fewer and fewer will present with the advanced cancer initiatives. So as Ambrish has also said, the primary care is important, but it should just not become just a pathway or a passage of people to go by. Ki card yahan bhi use kiya, but they say, no, we can't do anything here. You go to the next center. So that will not work. We have to empower them in a simple protocol based way of what best they can do for the preventive healthcare. And for that, again, going back to our philosophy and the ancient mantra of the Abhimanyu theory, okay? Because we believe in women's healthcare space that it all begins in utero, because that is the point where the programming of the next generation happens. And we have tied up with the international organizations for what you call the good air, because the environment inside the uterus and environment to the pregnant women to which she is exposed to a lot of toxins in the environment. So that's a big movement that we are starting with the international community, being sensitive to that fact, and good food in alignment with the Poshan Abhiyan, pre-pregnancy, pregnancy, and post-pregnancy, the good nutrition, because the malnutrition and the under and overweight babies in the women is the seed for the future NCDs. And therefore, a whole tsunami of the unhealthy next generation can be prevented by investing the maximum in the community of women who are embarking or going to embark on a pregnancy, and when they are pregnant, and for a long, long term postpartum, because the pregnant women and the next generation has to. So with these thoughts, I think the segment of women and child healthcare in terms of good air, good food, good health, accessibility, and for as a fundamental right, because it is not a disease process. She is called upon to reproduce, to continue the human generation, and whether in public or private sector, this is one issue which has to be treated and looked upon through the gender lens as well. And in keeping with the SDG Goal 3, good health for all, accessing universal healthcare, and capacity building, which is our passion through our own organization, Asian Research and Training for Skill Transfer, It's not the theoretical knowledge, but actually what they do. So the ART of artist is A for advocacy, R for research, because we need to document and audit and learn our lessons as we move forward, and T for training or capacity building, which we are doing through FOXY in our quality accreditation Manyata initiative, empowering the teams in the hospitals, not only the consultant or specialist cadre, but all the paramedical team who completely understands what they need to do, how they need to do, and why they need to do. Some short, quick fix solutions which can easily be implemented. So another tagline for us is innovation to implementation. That's the gap we need to bridge to have the necessary impact. It is a pledge, once again, Kamalji, to connect and collaborate, whether it be East or the West, we have to be the best. Thank you very much.
Thank you so much, Dr. Hema Diwakar. And definitely we need to prevent that tsunami of malnourished or the people who will, kind of develop these NCDs before they actually reach to that level. Dr. Ambrish Mithal and Dr. Nishant Jain, just a small remark by the time, the next panel joins in. Like we are doing, Ayushman Bharat PMJ scheme under National Health Authority in a very, I think, focused mission mode pattern. How the same can be done for improving, enhancing, and setting up the whole this 1.5 lakh or more than that if needed, these health and wellness center which are functional, effective, robust, and has not only the medicine available but also the required technology or the trained manpower or human resource, or maybe even open up the space for public private partnership as we are doing in PMJ. How, is there a way to achieve that? Because I think that's where lies the cure for India's healthcare problem. Dr. Ambrish Mithal. Sir, you are on mute.
Sorry. So I think there is no doubt, Kamal, that is the way forward, as you rightly said. But I also know that the actual implementation processes really cannot be outlined here. But the truth is that it requires focus now. So it requires to set up a parallel silo in the whole system, which is looking after this. Because the difficult part, of course, was providing care for complex disorders to our public, which is still ongoing and still has a long way to go, but where we have made considerable progress. So for this also we need to focus, and I don't think it's something that cannot be done. The investments required in this are much less. The finances required in this are much less. It's mainly about setting up processes, and I think the correct processes and a lot of use of technology will go a big way in this. Monitoring lot of it can be done by remote technology now. Remote monitoring can be done by technology for everything. So similarly in this, connecting these health centers to higher centers, as Dr. Hema was saying, but all this, lot of it can be done with the appropriate use of technology and using NDHM like tools to connect. I think this requires much less investment than our tertiary healthcare does. So I think it's just a question of focusing on that. But I will quickly make 2 points before I let you go, because then I will have to leave also. So 2 quick points. One is I completely endorse what Hema was saying. I think maternal nutrition, in the context of my specialty specifically, undernourished mothers give rise to give birth to children who are more likely to get diabetes and metabolic disorders. Overfed mothers also do the same. So maternal nutrition is also undernourished. Pioneering work from Pune by Dr. Yagnik's team and others has shown that maternal undernutrition is very important for long-term NCD. That's one important point. And the last point I'll make is on the corona pandemic, not in terms of corona, that's a separate discussion, but the fact that some experts, and I totally agree with that, are calling it a syndemic. What would happen if a population has 5% prevalence of diabetes, another population has 40% prevalence of diabetes? If corona or any other future pandemic hits a population which has a low diabetes prevalence versus something that is a population that has a high prevalence of NCDs, the impact will be very different. So since we know that non-communicable diseases make us sitting ducks for the coronavirus, if we have populations that have lower prevalence of non-communicable disease like diabetes, etc. In the long run, these pandemics may again come after 20, 30 years, who knows? Then we will be in much better shape because our mortality, morbidity will be much less. So there's a connect between infectious and non-infectious here. Infectious disease, epidemic disease, pandemic actually is hitting more those who are affected by non-communicable disease. So a strategy to even combat corona in the long run needs to have control of NCD in place. I'll stop there.
Thank you so much, Dr. Mithal. These are important aspects, and I'm sure as you are endorsing that, there is a way to, kind of the restructure, enhance, and I think boost up our primary health setup as well. Dr. Nishant Jain, your experience of, so I'm, you may get some background noise of my child, crying at the background. So I'm sorry for that. This is what the, I has kind of become the part of the modern days or pandemic day discussions and work. So Dr. Nishant Jain, your thought on that, and after that I will hand it over this the further conclave and the next session to my colleague and global health advocate and co-founder of ISW Council, Dr. Bobby John, for the next session of this conclave. Dr. Nishant Jain.
Thanks, Kamal. And so, as you were asking about health and wellness center and how the preventive and primary part can be actually strengthened much faster. And I think that a lot of work has already started happening. I think more than 30,000 or odd wellness centers have already been set up. But at the same time, also we need to understand that it's not only infrastructure. It's not only putting up a building and that's it, because you need people, and at that level to have so many people who are trained, who are available, who are willing to go to those kind of areas in the field is something where a lot of reform needs to happen, which is not only medical per se, which goes beyond medical. And I think that's where the challenge will be for the government to how to actually create an atmosphere to use the health and wellness centers. So number one, to create them, which is very important. But number two, that people should start using them. Because even if you create, and for a small headache, I go to the medical college, then it defeats the whole purpose. And that's where I think the challenge is right now also, that how do I create this whole continuum of care approach, where people first go to the nearest health and wellness center, and then they get referred for things which are required. And I think that will take time. It will take a lot of effort, reform in terms of making people aware, also in terms of putting yourself in such a good quality that people are attracted to go there. If there is a building of health and wellness center, it looks nice, but there is no doctor inside or there's nobody to provide care, then people will not go there. So I think that is another point which is very important, that building is there, people are there who are trained, but then the behavior of people also change so that they go there. And the last point regarding this whole continuum of care is the technology, what Dr. Mithal also mentioned, because if you can link with telemedicine and all these kind of things, a lot of things can be provided at the doorstep itself. You don't need to travel very far. That can increase the reach, that can increase the attractiveness, and at the same time reduce the cost. So I think these things, if it happen, technology, human resources, and the trained human resources, and the whole awareness campaign, then that can help a lot in these kind of things. And as Dr. Mithal already mentioned, within Ministry of Health, of course, there has to be a focus. And I think there is a team which is working already on this. So I think that they can take care of these things. Thank you.
Thank you so much, Dr. Jain. And I'm sure with the NDHM, becoming a reality after some time, wellness and some part of it may be delivered at the home of the people, through telemedicine or your Dizzy doctor or something like this. So thank you so much, all our esteemed panelists today, Dr. Ambrish Mithal, Dr. YK Gupta, Dr. Nishant Jain, Dr. Hema Diwakar for joining us. We are thankful to Honorable Minister Shri Ramdas Athawale also, who spared time in this busy schedule of today's special day.